How are you doing? Okay, how many do we have today? 79. Okay, let's few more. Okay. May tidur lagi ni kot. Kau tak pergi round bagi tadi? Okay. Good morning. Before we start, do you have any question on anything at all? Okay, JJ, your class rep, your course rep, contacted me on the exam. He said you decided to have the exam on the 25th instead of 29th. 25th. Okay lah, Monday. Tapi saya terbuat lagi soalan. Okay, I'm okay to do on 25th if everybody wants to do on 25th. Okay, so it's gonna be a 2 hour, not 2 hour, 1 hour or more. 1 hour and a half ke something macam tu. So we'll start a bit early lah, pukul 8 pagi ke 8:30 ke apa ke. Okay, another one is, JJ, could you please book the Audi? Because I think we are going to do physical examination. Okay, physical exam for test 1.
Doctor.
Okay. For the format of the exam, honestly, I forgot already because we have been doing a lot of online exam before. There'll be like everything, a mixture of stuff. It's gonna be some MCQ, some short answer, and a lot of figures. I'll probably do some figures where I will show the lesions or whatnot on the screen, and then the question will be on your answer sheet. For example, like that, describe the lesions. What is the most likely diagnosis? Give me 2 differential diagnoses based on this picture. Okay, something like that lah. Or very simple thing. Name this organ. Okay, what is this organ? What is that? What is that? So it's basically all the pictures. And just revise all the notes, then it should be there. Okay, any other question related to the exam? Okay, I'm sorry, I haven't uploaded the previous ND and AI lecture notes yet. I'm still actually editing some stuff. But for today's lecture, I already uploaded it because for today's lecture, it's already short and simple. So I've already uploaded it. Any other question? Or you want quiz? Baiklah. Yang saya jawab balik. Okay, let me see. Share screen. Screen 1 or screen 2. Stop share. Screen 2. So for today, we are still on respiratory diseases. Okay, we had Newcastle disease before and avian influenza before, and also aspergillosis in the previous lecture. So those are some of the common respiratory disease. And we are going to continue with another common respiratory disease, which is infectious bronchitis, infectious laryngotracheitis, and fowl pox. We'll see if we have enough time, I can proceed with the next lecture as well. Okay. For infectious bronchitis is one of the common one, like one of the most common is same level as ND and IBD, because this is one of the virus or disease that you must vaccinate in broilers and not broilers lah, all chickens, in basically all chicken, in broiler, layer or breeders. Okay. The history of this disease was first seen in North Dakota in USA in 1930s. Okay, as respiratory disease that can cause mortality in chicks. Later on, it was observed more and more in semi-mature and laying flocks. Okay, so this is some of the history lah. Okay, you don't have to memorize it. Okay, this is some of the history. In 1936, Bish and Sham established the virus etiology. They figure out that this is caused by virus. And in 1937, Budet and Hudson first cultivated the virus in embryonated chicken eggs. Okay, if you notice all this name, Bish, Budet, all these things are the old people that what do you call it? Doing research in poultry. If you refer to the previous lecture on Newcastle disease, we have the Bish form, Budet form. Okay, these are referred to their name. In 1940s, the disease was associated with decrease in egg production and respiratory problem in layers. And later on, some kidney lesions was also observed in certain strains of infectious bronchitis. The incidence of this disease is basically worldwide. Like I said just now, it's very common. Okay, it's very common to get infected with infectious bronchitis. As long as you are poultry producing countries, you basically probably have some strain of infectious bronchitis in your country. Okay, the etiology is the same as COVID, coronavirus. Okay, I think you have heard this before. Although they are coronavirus, but they are sort of like different. One is alpha, one is gamma. It's not the same as the COVID-19. Okay, the antigenic, they have great antigenic variation among IBV strain, similar with COVID as well. When I'm referring to antigenic variation like COVID, they can mutate and then they change, become Omicron or the Delta and whatnot. Now they, if I'm not mistaken, in the news they're mentioning about Delta 2. Okay, or is it Delta 2 or Omicron 2? I think Delta 2. Okay, it's like a variation of Delta, and they belong to many serotypes. Okay, similar to COVID as well. So what are the implications of many serotypes? Any idea? Anybody want to answer? Quite the opposite of Newcastle disease. Newcastle disease only belongs to one serotype. But infectious bronchitis belongs to many serotypes. I've asked before that what are the definition of serotypes? Serotypes referring to the antigenic reaction, the immunology, the immune response towards it. I want to read chats. Require polyvalent vaccine. Yes, sort of. Okay. It requires specific strains to protect against it. Okay, that's the difficulty when it comes to controlling infectious bronchitis. So in general, still on the introduction, is an acute, highly contagious viral respiratory disease of chickens characterized by rales, coughing and sneezing, nasal discharge in young chicks, mortality due to respiratory or kidney manifestations. You will receive poor weight gains and feed efficiency, severe renal disease associated with nephrotrophic strains. So some of the strains of this one can also cause renal problem. Okay, like some COVID lah. It's like some COVID. Some strains are more severe than the other. Like Delta, okay, can cause high mortality in comparison with Omicron. Omicron, they spread much faster, but they can cause milder diseases. Okay, so it's quite similar with infectious bronchitis. Marked decrease in egg production in layers. This is one of the disease that can cause decrease in egg production as well as egg quality in chickens. Okay. Kidney involvement appear to be increasing in incidence around the world. Nephrotropic strains may be highly lethal. Okay, those chickens that also have lesions, those strains that can also cause kidney issue, usually you will not, the farm will experience much higher mortality, okay, compared to the other strains. The morphology of this virus is pleomorphic, okay, but usually you will see rounded under the electron microscope. It's an envelope RNA virus, like COVID as well. It's an envelope virus, so it's quite easy to destroy. Okay, by using detergent is enough because you just need to destroy the lipid envelope around it, and then the virus is gone. Okay. The virion contains 3 virus-specific proteins, large pi S or E2, S1 and S2. S1 induces HI and neutralizing antibodies, viral neutralization antibodies, and small matrix glycoprotein, M or E1 we call it, or internal nucleocapsid protein. Okay. The resistant thermostability is the virus is inactivated after 15 minutes at 56 degrees Celsius, and for chemical reagent inactivated by 0.1% beta proprolactone or 0.1% formalin. Usually, when it comes to disinfectant in the farm, we also use formalin. Okay, we use formalin. If you go to the farm, they use a lot of formalin to disinfect the farm. Okay. Strain classification usually is based on viral neutralization tests, HI tests, enzyme immunoassay, monoclonal antibodies, oligonucleotide fingerprinting, and nucleic acid sequencing. So this is how we have classified them on different strains of infectious bronchitis. It's quite similar with COVID also lah. That's how they classify as Delta, how they classify with it's as Omicron or something. Okay, but nowadays the most common classification method is the nucleic acid sequencing. We do sequencing and then you can classify the strain already. For this virus, the laboratory host system is you can grow it in various medium. Okay, chicken embryo, you can infect it in chicken embryo 10 to 11 days old. What you expect to see in the eggs is dwarfing and stunting of the embryos. The embryo will die, and if they survive, some of the embryo will show sort of like urates formation in the mesonephron, in the kidney. Okay. If you infect in turkey embryos, you expect the turkey to die, the embryo to die. You can also infect in organ culture, trachea rings, okay, of 20-old embryo, and you'll see ciliostasis. So basically, you'll see like all the cilia are kind of gone, okay. And then you can also infect it in cell culture. I think you have done this probably. I'm not sure which virus you use for your practical for virology. I think IB should be one of it. Okay, you can grow in chicken embryo kidney, chicken kidney cell, or chicken embryo liver, and expect to see the cytopathogenic effect. The pathogenicity of this virus can also be classified into several classifications. One is apathogenic. Okay, means like they don't really cause disease, like the Budet strain. Some are pathogenic, they can cause mortality. And we have the much more virulent one, nephropathogenic, or the most virulent strain, the one that can cause kidney issue. Okay, M41, Australian tea, Italian, USA Grey, Holte, Massachusetts. Okay, all these things. You don't have to memorize all, at least remember one. Unless you work in poultry field, then it's quite common for you to know all these things. Okay. Natural host for this virus is chickens, and they can also infect other animals as well, like pigeons. The transmission for this virus is through aerosol. So basically, direct contact, airborne. Okay, contamination of personnel or equipment, fomites, and carrier birds 3 to 4 months after infection. Usually, the bird can still shed the virus. Okay, it's like us also lah. Okay, even though we are vaccinated, after we get infected, we can have some chances to spread the virus to others if they are not vaccinated. Okay. The incubation periods is around 18 to 36 hours, depending on the dose, route of infection. The clinical signs, what you expect to see in this disease, usually very much related to respiratory signs. They are gasping, coughing, sneezing, rales, nasal discharge, and swollen sinus occasionally. But most of the time, I've rarely see swollen sinuses unless they are co-infected with other disease as well. Okay. And you'll see generally they look like weak, depressed, huddling, ruffled feathers, wet droppings, and increase in drinking. Reduce egg production and quality in layers. This is one of the common findings when infecting layers and breeders, because this is one of the diseases that can affect egg quality and egg production. Okay, you expect to see soft shell eggs, misshapen, and watery albumin. Watery albumin is like you crack the egg and then the albumin, the telur kuning tu, is not like the same consistency. It's like very much watery. I think some of the kalau you goreng telur pun kadang-kadang you will see that kind of eggs as well. Okay, mungkin lah ladang tu pernah infected with IB or something. Okay, this is the common findings. They have generally general clinical signs of respiratory disease. Okay, in chickens, they're gasping. Usually, those chicken that have respiratory disease, they have difficulty in breathing, so they extend their neck like that. Okay, and then this one is one of the unique strain, the QX strain. They in this QX strain, they're quite unique. They leads to call it penguin stance, we call it. Okay, they will sit like penguin. The reason being because this QX strain can also cause kidney issue as well as ascites, sort of ascites. So dia punya stomach tu penuh dengan air. So dia duduk. Sebab dia jadi berat. Perut tu jatuh ke bawah. All the abdominal cavity tu jatuh ke bawah. So that's why they're all sitting. This is quite unique lah. We also have it in Malaysia. Okay. If you notice this kind of stance, so you have to suspect it probably QX strain, infected with QX strain. Okay. This one like egg quality issue. Gross lesions, okay, if you open up chickens that you suspect with having infectious bronchitis, you expect to see trachea, nasal passages, and sinuses to have serious catarrhal or caseous exudate, caseous plaque, or slight inflammation. Usually, for infectious bronchitis, you see caseous plaque at the bifurcation. Kan kat bawah tu trachea, lepas tu dia bifurcate dekat lung tu. Okay, usually you see caseous material attached at the bifurcation. Okay, bifurcation tu kalau if you open up and then you see bifurcation punya plaque tu, so your differential of IB should be on the top lah. Okay, SX cloudy yellow caseous exudate. In large bronchi, you'll see pneumonia. In kidney, those that are nephrotrophic strain, you will see swollen and pale, tubules and urates distended with urates and uric acid crystals, and oviducts may be hypoplastic or cystic. Okay, if they are affecting the reproductive system. So this is what I expect to see. Kalau ayam dia ada 3 lobe of kidney on each side. 1, 2, 3. Normally, kidney of chicken doesn't look like this. It should be flat on the surface at the back of the chicken. Kalau korang makan peha ayam, bukan drumstick peha. Okay, peha ayam. Kadang-kadang kalau mak korang goreng, kalau dia apa tu siang dia tak cabut kidney tu kan. Yang dalam tu, yang macam hitam-hitam macam brain kat dalam tu. Those ada kidney actually. Okay, kadang-kadang you makan goreng ayam kan, yang macam dia nampak macam brain kat dalam tu. Yang korek-korek tu macam nampak brain kat dalam tu. So those ada the kidney. So this thing, okay, usually it's flat. You can see here, you can see the tubules, obvious tubules, nampak tak? Filled with urates. And then this is the ureter. The ureter, you usually don't see as big like this. Ureter patutnya dia satu line je macam tu je. And then this is engorged with urates. Tak apa, nampak tak besar ni? Okay, gemuk ni. So urates. So same as here, all urates lah. If you do histology, what you expect to see is on the trachea and bronchi, they are desiccated, thickened mucosa and submucosa with cellular infiltration and edema. You can see here, okay, nampak kan? Kalau you nampak histology, you nampak cartilage macam ni tu, okay, and then lining of mucosa macam ni. So this is the trachea. Kalau saya keluarkan exam histo macam ni, selalu budak tengok tak tahu apa benda. Dia tengok setengah jam pun tak tahu ni organ apa. Okay, so you have to be good in your histology also lah. Okay, so it's quite, you can see this is the normal structure of cartilage. This is the submucosa, edema, and then you can see all these inflammatory cells. Nampak tak banyak-banyak? Okay, so what do you expect? This is a infiltration of inflammatory cells and edema. Dia patutnya tak tebal macam ni pun, trachea. And then you can see the cilia is gone. Tak nampak pun cilia kat atas ni. Patutnya kalau trachea dia ada cilia kan. Okay, if you refer back to your histology notes, this is the cilia. Patutnya ada cilia. Okay, and this is a kidney. Kidney, kalau kidney senang je nak tahu histology, nampak tubules tu. Kadang-kadang nampak glomerulus. Okay, so this is a kidney. You can see acute interstitial nephritis. You can see the parenchyma of the kidney is kind of gone. Tak nampak the tubule tu pun, dia punya structure tu punya cell tu dah tak nampak rupa sel dah. Okay, and tubular necrosis. On diagnosis, so usually we do diagnosis based on the clinical history. You'll see the signs of respiratory disease, vaccination status, and whatnot. And then you can do antigen detection, immunofluorescence techniques, and you can also do virus isolation, and you can also do typing. You want to know whether what serotype it belong to, what strain belong to. Usually we do sequencing. But the most common one, kalau sekarang ni, we just do serology, ELISA, okay, and then we do PCR. Senang, okay. Unless you nak virus isolation, we rarely send for virus isolation unless you want to keep the virus for something, okay. So usually we do PCR and then buat sequencing. So serology test, okay, this is the common serology test is ELISA. Yang ni pun, yang lain ni boleh buat. You can do the other test as well, but it's not very commonly done lah. Okay, the most common one is ELISA. Antibody produced by IBV antigen has dual binding characteristics. Okay, number one is group-specific antigen shared by all types, and number two is type-specific antigen, which is on the S1 glycopolypeptide. Therefore, serological tests cannot differentiate IBV types. Okay, usually kalau serologi tu you tak boleh differentiate tu ni serotype mana. So they produce these two type of response. Okay, type 1 primary antibody response is mostly type 1 specific, and secondary antibody response usually broadly reactive to specific serotype. Okay, so differential diagnosis when you have this kind of respiratory disease similar to IB is ND, ILT. They show sort of the clinical sign. But if you list down any other respiratory disease, is also correct. So because in general they look almost the same. Respiratory, all the disease of respiratory disease, they look almost the same clinical signs. For the control, it's quite easy. Okay, we have vaccines against it. We just need to use the vaccine. And again, of course, biosecurity. The vaccination, we have live vaccine and inactivated vaccine. And we are supposed to be type specific. In every region, every country, they usually have the predominant serotype. Okay, predominant serotype. So you need to use a vaccine that are specific to your region. Okay, kalau in US they use Massachusetts strain, Holland and Connecticut strain, Florida, Arkansas also we use, but they need the special license. This is the strain name. The strain name they name it based on the where the virus was isolated. Massachusetts lah, Holland lah, Connecticut. Okay, so these are the strains. Netherlands, they use the Holland strain and then these other vaccine strain lah. Australia, they use B and C subtypes. In Malaysia, most of the time we use the Massachusetts strain, M41. Ada ke tak? Tak ada. Okay. Malaysia, most of the time we use the Massachusetts strain. I think I've uploaded the vaccine list that is approved in Malaysia. You can refer to that notes. What are the strain that we have in Malaysia? But most common is Massachusetts because Massachusetts punya vaccine, they can provide a broad cross protections against other strains. Okay, maybe not as good as local strain kalau you develop your own local strain, but they can provide good protection. Okay, that's all about IB. Any question? Second one, okay, I'll proceed to infectious laryngotracheitis. Okay, this is, I wouldn't say common, but you will see occasionally jugalah. Okay, it's one of the vaccine virus that we also vaccinate in chickens. Okay, the etiology is herpes virus, Gilead herpes virus type 1. Icosahedral virus particle, double-stranded DNA virus, was first described in 1925. First major avian viral disease for which an effective vaccine was developed. Okay, this one among the earliest avian vaccine. Okay, yang developed against viral disease waktu back then. Okay. ILT belongs to single serotype. So macam ND. So senang. One vaccine protect against all LTV strain. You tak kisah your vaccine daripada company mana ke, brand apa ke, you can use that one. It provide the same protection. Sort of the same protection. Okay. Unlike the IB just now. IB, you have to choose which serotype are predominant in your region. The sites of replication is the respiratory tract, primarily the trachea and the conjunctiva. The infection result in persistent, long life infection with lifelong intermittent shedding. Okay. So this is the characteristic of herpes virus. Okay. Herpes virus, they can become dormant. Initial infection with field strain or modified live vaccine strain. Okay, and then they become a lifelong latent infection. They become latent and they can become reactivated again. Okay, intermittent shedding, lifelong source of infection for other chicken. So usually for ILT, they become latent in the trigeminal ganglion, in the nerve. Okay, quiz. In human, what herpes virus are you infected now? Are you latent? Tahu tak? All of you actually most likely have herpes virus in your body. What herpes virus is that? Ainina, raise hand. Answer the unmute. So you
Not sure,
tertekan.
doktor.
Ah?
Tertekan.
Ingat baru nak volunteer. Okay, siapa tahu?
Doktor,
Yes.
chicken pox ke?
Chicken pox. Okay, chicken pox itu virus apa? What is the virus? Virus name? Ke korang tahu chicken pox je?
Is it varicella zoster virus, doctor?
Yes, varicella zoster virus is a herpes virus also can cause chicken pox in human. When you get infected with chicken pox, when you are little, siapa yang tak pernah kena chicken pox lagi? Ramai tak pernah kena. Okay, so be careful. Okay, because getting chicken pox as adult is quite annoying. Okay. If you have been infected with chicken pox before, the virus basically is in your body for the rest of your life. Okay, it become latent. And then it can become reactivated. Kalau the chicken pox become reactivated, dia jadi apa? Kayap. Yes, kayap dalam bahasa Inggeris apa? Shingles. Yeah, it can become shingles. Okay. If I'm not mistaken, last few years, just right before COVID, I was teaching the class. I asked the same question to the class. Okay, I asked the same question to the class, herpes and chicken pox and shingles. Bila I cakap shingles, and then everybody looking at this one boy. This one boy tengah kena shingles. Okay, in the middle of having shingles. Dia lalu dekat muka dia. Okay, everybody looking at him. And then everybody was laughing. And then I told them, you are laughing now. Now raise your hand. Who haven't have chicken pox yet? Okay? And then some raise your hand. And then 2 weeks later, there's a chicken pox outbreak in the batch. Okay, like 5-6 students kena chicken pox. Okay, because it's the same virus. So if you have shingles, do not mix with people that haven't have chicken pox yet. You will give them chicken pox. Okay, that's why. Yeah. I say batch DPM5 sekarang kot. Yelah batch DPM5 sekarang hari tu waktu saya mengajar orang. Okay. So that's the characteristic of a herpes virus. They can become dormant. So and then chicken pox, shingles ni selalunya berlaku if you are stress, if you are immunosuppressive, and then they become reactivated. So you get shingles, kayap. Okay, so jangan stress musim exam. Nanti tak pasal-pasal kena kayap. Dulu waktu Waktu saya budak-budak dulu, waktu saya sekolah asrama, waktu form 1, ada seorang budak ni kena kayak. Lepas tu budak-budak kata dia, kalau ni kayak ular ni, kalau lilit perut nanti mati. Budak tu menangis sampai quit sekolah. Dulu lah, there's orang kata kayak ular. I don't know lah. Kayak ular is like, kayak is like this thing lah. They look like kurap, but if follow, the kayak will follow the nerve. Okay? Nerve line. You'll follow the nerve line. Tapi it's very, very itchy because it attack your nerve. Okay? Continue with the lecture. Okay. Intermission kejap tadi. The transmission of infectious laryngotracheitis virus is direct contact through inhalation and conjunctiva, and as well as mechanical transmission, fomites, dirty equipment, and whatnot. ILTV infected chickens, we can be classified into actively infected or latently infected. Latently infected usually are those are vaccinated lah. Okay, vaccinated. Backyard exhibiting birds, common endemic in this kind of birds, they are latently infected. Actively infected is the one that showing clinical signs. The clinical signs can be divided into acute and chronic kind of thing. In acute, they show marked dyspnea, coughing, sneezing, rales, loss of appetite, and depression. What do you expect to see? Because laryngotracheitis literally blocking the trachea with blood and caseous material. So, waktu diorang nak bernafas tu, you imagine if something is blocked. So the chicken will, during inspiration, they extend the neck to inhale, and during expiration, they will like cough it hardly to exhale the blood and the caseous material. I remember this because my PhD is on 2 diseases, infectious laryngotracheitis and Marek disease. I co-infect the chicken with infectious laryngotracheitis and Marek disease. I've seen a lot of like bad clinical signs in infectious laryngotracheitis. They literally sometimes tu, diorang batuk sampaikan burung tu terbang ke belakang. Okay, they want to like coughing out all the blood and caseous material, so and then they terbang. Okay. In mild form, lacrimation, conjunctivitis, nasal discharge, and swelling of the infraorbital sinuses, and as well as reduce in egg production. Okay, infectious laryngitis. This is how they look like. Okay, ni, and then kalau you pergi farm, kadang-kadang, ni, dia extend their neck macam ni. Dia bernafas macam tu. And then bila dia exhale, darah keluar ke mulut. Darah keluar. Okay, in postmortem, it's quite easy to diagnose ILT. Okay, in postmortem, you expect to see hemorrhages of the trachea. Like not just hemorrhages like merah-merah tak ada, like literally blood in the trachea. Okay, blood clots in the trachea or mucus or caseous yellowish exudate, or we call it the tracheal plaque because they plug the trachea. Okay, like this. Okay, blood in the trachea, like fresh blood, a blood clot in the trachea. And then imagine this one is okay. So penuh dengan caseous material in the trachea. This one also, they produce diphtheritic membrane. Sampaikan dia jadi satu layer membrane macam fibrin kat situ. Dia melekat kat situ tu. You boleh actually remove it. Some example of different ni lah. Okay, for diagnosis, you can do histology. You can expect to see syncytial cell. Are you familiar with syncytial cell? Pathology patut ajar kan? Syncytial cell. Pernah dengar kan? I assume you pernah dengar. And then kalau tak pernah dengar, please Google and find out or refer your pathology notes. Kalau tak, nanti saya call Dr. Mazlina. Tanya dia dah ajar ke tak. Okay, and then you expect to see intranuclear inclusion bodies. This is one of the characteristics of herpes virus also. They cause inclusion bodies. But inclusion bodies in chickens, okay, infected with ILT, you only expect them to see within 5 days post-infection. After 5 days, they sort of been cleared off, okay, by the immune system, and then the inclusion body tu dah macam tak nampak lah. So if you go to the farm a bit late and you take histology and you see there's no inclusion body. So doesn't mean they don't have ILT. It's just that you may not see inclusion body because it's already a bit late. Okay. You can also do fluorescent antibody test on the trachea epithelium or isolation of the virus on the CAM, choroid allantois membrane, and then you see plaques. Waktu virology korang pernah buat kan? Choroid allantois membrane and then see plaque. Pernah nampak tak? Virology practical? Inject choroid allantois membrane, nampak plaque yang biji-biji macam pox tu. Okay, and then you can also demonstrate viral antigen based on PCR also lah. Okay, this is how the trachea look like normally. Okay, ni yang saya nak tunjuk tadi tu. Ni trachea, ada cartilage, ada some soft tissue, and then you see cilia. And then some goblet cells. Sebab dia nak produce mucosa, apa tu? Secretion kan. So, and then cilia semua kat sini. Okay. And then this is when it is infected. Okay, you can see the cartilage. And then see how thickened is the trachea. Okay, yang ni daripada research saya saja, daripada projek PhD saya ni. Okay, filled with inflammatory cells, gaseous material. Okay, so thickened. And then if you look closely, you see this one, syncytial cells, multinucleated giant cells. Satu sel ni yang penuh dengan sel-sel ni. Okay, syncytial cells. And then, you also expect to see inclusion bodies. Intranuclear inclusion body. Dia macam clumping-clumping dalam nukleus tu. Okay. This one pun, ni kalau CAM lah, choroid allantois membrane. Kalau you infect the eggs with choroid allantois membrane, you see the plaque. Biji-biji. And then you can, if you do fluorescent antibody, you expect to see all the antigen, the virus. Okay, for control is easy. Okay, there is a vaccine against it, but if you are in US, in many countries also lah, do not vaccine the farm unless is needed. Okay, do not vaccine the farm unless is needed, because sometimes it can lead to rolling reaction. I think I dah explain rolling reaction before kan dalam previous lecture. Okay, yang saya bagi example hari tu, yang case ILT hari tu. If you give, this is one of the disease that, especially the chicken embryo origin virus, if the vaccination was not done properly, tak sekata, only some chicken infected, and then the virus can regain its virulence. Okay, sebab dia keep infecting the new one. The vaccine tu, the vaccine yang ni dia dapat selalunya yang belakang tu ataupun yang tengah rumah tu akan dapat the original strain of the virus. Okay, the vaccination only do if necessary. There are two type of vaccination, chicken embryo origin and tissue culture origin. ILT vaccine ni dia unik sikit. All the vaccine are live vaccine. Dia tak ada kill vaccine. Okay. So that's why it's a bit difficult to control rolling reaction lah. Live vaccine memang selalu ada rolling reaction. Okay, that's all on ILT. Okay, I think, okay, last one lah, senang. Okay, tak sempat. Last one is Fowlpox. Okay, is pox virus ataupun kalau dalam bahasa Melayu kita panggil puru. Okay, kena puru. Puru. Yalah, puru. There's a lot of pox virus out there. Okay. They can infect chickens, can infect pigeon, can infect myna, can infect turkey. But each individual of them are host specific. Host specific. Walaupun dia boleh infect banyak-banyak benda, tapi actually different strain tu sebenarnya. Yang infect pigeon, only infecting the pigeon. Infecting the quails, only infecting the quails. Infecting turkey, only the turkey. Infecting the chicken, only the chickens. Okay. If you want to see pox virus, actually kat belakang sekarang ni, dekat ward tu sekarang ni, saya ada bela ayam dekat 10 ekor untuk budak-budak di VM4 buat rota. Most of them infected with pox virus. Kalau you pergi belakang tu, bolehlah minta senior you tunjukkan. Okay, banyak chicken yang kat belakang tu kena pox. Or, if you go to Batu Cave, if you go to Batu Cave, I've noticed many of the pigeon there, Batu Cave have a lot of pigeon. Many of the pigeon there have pigeon pox. Muka-muka dia sampai berbiji-biji, muruk je muka dia. Okay. You can also go there lah. So if you visiting Batu Cave, kadang tengok kat burung-burung dia tu. Okay, it belongs to the family Poxviridae, genus AVI virus. Is an enveloped double-stranded DNA. It's a large virus. Pox virus is a large virus. That's why they have some other vaccine. No, Pox virus is used as vector. Dia masukkan gene virus lain ke dalam pox. Sebab dia punya gene tu besar. Boleh masukkan. Okay. The pox virus can divided into cutaneous form and the diphtheritic form or the wet form, dry form and wet form. The dry form is the one that causing skin lesions. So basically it's the same virus je. Tapi dia boleh produce two form of manifestation. Okay. Proliferation of lesion at the skin which scab, or it can also infect the oral cavity, lesion in upper GIT and the respiratory tracts. The transmission is through open skin and vectors, okay, which is mosquito and biting insect. Kalau ladang yang ada pox tu, senang je nak control. You ambil chicken yang ada pox tu, asingkan. Sebab kalau kawan dia pack dengan pox tu, kadang-kadang kawan dia tengok ada apa tu, scab atas kawan dia tu, kawan dia pack kan, lepas tu dia makan, lepas tu kawan dia pun kena lah. Okay, ataupun you have to control the mosquito. The clinical signs usually mild. Sometimes it can become severe. Okay. Okay, because ada gambar tak pox Okay, macam ni. Selalunya macam ni je pox. They have like scab-like lesion on the skin. And then the scab-like lesion only will grow on the non-feathered area. Dia tak akan tumbuh dekat badan. The non-feathered area dia akan tumbuh dekat muka ataupun dekat kaki. Okay, di Turkey pox. Okay, dekat muka nampak buruk lah. Okay, dekat muka. Ni lah, yang ni lah, kalau severe form dia macam ni lah. Dia tutup mata. Selalunya, those that die due to chicken pox, avian pox, is not because of the virus itself. It's because the scab close their eyes or close their mouth, they cannot see the food. So they die of starvation. Ni kalau macam dry form kan, dry form, dia masuk dalam mulut dia. Kalau yang severe punya macam ni, dia tutup opening of the mulut tu. Macam ni, nampak tak? Okay, so dia tak boleh makan. So, dia orang mati bukannya sebab virus tu infecting the body systemic ke apa, tak ada. Dia very localized. Tapi kadang dia mati sebab tak nampak. Okay. So, if you want to do diagnosis based on the clinical signs, it's quite obvious lah. Yang ni paling senang. You nampak, dia tahu, ni pox ni. And pox lesion. If you want to do histology, it's quite unique also. You can take do H&E staining on the scab tu. Expect to see eosinophilic cytoplasmic inclusion bodies. Okay, quiz. Kalau korang dah belajar pathology, rasanya pathology korang pun belajar pox kan? The inclusion body for pox ni dia ada nama dia unik. Anybody can guess? Kalau dalam rabies kita panggil negri bodies. Pernah dengar tak negri bodies? Dia cakap seseorang lagi. Okay, kalau dalam pox ni kita panggil Bollinger bodies. Okay, kita panggil Bollinger bodies. Bollinger. Okay, so pox ni one of the virus yang you infect into the choroid atlantic membrane and you can see pox lesion. Biji-biji dekat ni. Okay, this is the one. Okay. Epithelial cell hyperplasia. Nampak tak? Swelling of the cell. And eosinophilic intracytoplasmic inclusion bodies. Call it as Bollinger bodies. So saya tak letak Bollinger bodies dalam lecture notes. So siapa yang datang lecture tahulah. Nanti kalau saya tanya exam. Okay. So this is how they look like lah in general. Kalau yang teruk punya tu. Okay, some example. Control, okay, senang je. Vaccine, we have a vaccine against it. This is one of the vaccine that is given through wing web. Kita yang garfu tu, saya tunjuk sebelum ni kan, yang garfu tu, cocok masuk ke wing web dia. Dekat in between the humerus dengan radius ulna ni kan, ada satu tempat tu. Dia masuk cocok kat situ tu. Ataupun kalau dalam turkey, kita guna scratch. Kita tak guna wing web. Kita ambil benda tu sama je. Lepas tu dia lukakan peha dia. Scratchkan kat peha dia. Lukakan dengan virus tu. Okay. And then your immunity usually develops 10 to 14 days after the vaccination. And then for vaccine pox, selalunya kita akan check for ticks. Selalunya dia akan tumbuh pox lesion dekat situ. And evidence of successful vaccination. Okay, that's all for today. Any question? Any question on anything at all? Tak ada ke? Question on your test ke apa ke? Anything if you want to ask question? Okay. If there is none, again, selamat hari Jumaat. Selamat have a good weekend. And selamat berbuka later. Okay, siapa nak berbuka dengan saya boleh message. Okay, happy birthday pula dah. See you guys.
Hai doktor.
Ya saya. Siapa tu?
Saya Ainina.
Ainina, ya.
Doktor, yang untuk test 1 akan cover sampai hari ni punya topik ke?
Sekejap Test 1 lah. Nak cover sampai mana? Let me see. Nak tengok sinopsis lah. S1 kalau 25 hari bulan. Saya sempat habiskan nervous sign kot. Sekejap kalau saya habiskan nervous sign. Mungkin sampai minggu depan kot. Minggu depan punya lecture.
Okay doktor. Thank you doktor.
Okay, because ada banyak lagi respiratory disease yang tak habis. Okay?
Doktor. Thank you
That's
doktor.
all. Okay, see you guys.
Doctor, sorry.
Yeah.
May I ask that just now the M41 vaccine for infectious laryngotracheitis is can protect other strain also, is it?
It's not
Yes,
M41 is for bronchitis, not laryngotracheitis.
Bronchitis, sorry.
Can infect what?
It protects other strain also, is it?
Yes, it can have some cross protection. It's similar to COVID lah. Dia kata yang Pfizer ni can have a broader, can protect against Delta, Omicron and whatnot. And then Sinovac mungkin tak banyak sangat. Macam tu lah the concept dia.
Okay, thank you, doctor. Understood.
Okay, yeah. Okay, I think that's all. See you guys. Selamat Jumaat. Jom lunch.
Thank you doktor.
Bye.
Okay, dah.